Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Alright, so Pari, tell me what's going on with your legs, what happened?
Oh, at night time it's cooler inside on the left side.
On the
then
left
I put
side.
socks on both sides, otherwise
Okay.
it feels cold.
Yep.
And then the pain starts over here on the bottom and in the middle, all over in the back of the leg.
That's at night or during the day?
All the time.
All the
but
time.
it increases then it goes down.
Okay,
When I'm laying, I feel some, but not too much.
okay.
And when I get up in the morning, it's a lot of pain.
And when you walk, you feel it?
Some,
Yeah.
right now, but it builds up and then it goes down. When I'm walking every day, I'm walking slower.
Okay, so your speed decreased.
Yeah.
So how much constant pain do you have from 0 to 10? 10 is emergency room, 0 is nothing. How much pain do you feel like most of the time?
5, 6.
5, 6.
Actually, it goes down 3, 4.
Okay. And when it goes up, how much it goes up to?
Like 6.
6, okay. Do you feel pain right now?
Yeah, I mean in the back. And
In the back, in the hips.
Yeah.
How long this been going on?
It's been like a year and a half.
Year and a half. Did you fall? Did you have any accidents or
No
anything?
accident, didn't fall.
Okay. So how we aggravate your symptoms? By have you walking now and you will feel it?
When you ask me to walk,
Yeah. Does that make it worse?
no.
Okay. You just have constant.
Constant.
Okay. Did you have any treatment for this before coming here?
No, I had one doctor showed I use deep tissue oil. When I use it gives
Like
a
massage?
relief. Yeah.
Okay. Okay. Nothing else?
Nothing else.
Okay. Are you comfortable lying on your stomach?
No, I'm fine here.
Like when you're facing down?
Can you lie on your stomach?
I
Can you lie on your stomach?
can.
Okay. So we'll have you lie on your stomach, head there. So both of your calf
on the back?
on the stomach.
On the stomach.
Yep. Make sure everything I do here is pain-free, okay? Bend both knee. Both knee. You comfortable like that?
Yeah.
Okay.
You want to move it back or leave it there?
No, as long as you're comfortable, that's fine.
Okay.
So you feel the pain in the calf, both of them, and you
And up
sit
here.
in the hip.
And one hip and then the leg behind.
Oh yeah, so everything is tight. Yeah.
Yeah, it's like nerve pain.
Nerve pain. So can you tell me any other any medical history you have, like?
I have diabetes, but it's controlled with the diet.
Okay.
I've been eating like this 3 years.
And you said you had.
Plant-based and no fats, and you can see the blood report.
Okay.
And I'm taking those minimum medicine.
Okay.
It's controlling all that.
Yeah, you were saying you had a stroke. When did you have a stroke?
2012 in June 27.
Okay. Make sure what I'm doing is not painful, okay?
Okay.
Is it the left calf or the right calf is worse?
Left it was, they both have pain.
Okay. Is this painful what I'm doing here?
No.
Okay. Make sure it's not painful. So after the stroke, did you have any pain or did you have any symptoms from the stroke?
I mean, like balance was away, speech went away, everything came back, but then I've been doing exercising all around after the outpatient, so that's how we're doing.
Is that painful what I'm doing? It's okay.
It's okay.
Okay.
I can feel there's something in there.
Yeah, you will feel pressure. That's normal, but I don't want you to feel pain, okay?
Okay. Same nerve I can feel. But I can tolerate all that.
Make sure it's not painful, okay?
Okay.
And you said the hip. Do you feel it inside the hip or just outside in the
The
muscle?
whole, this
The
area,
muscle.
and from this is dorsal side and this, I can feel that too, a little bit.
Okay. Relax. What's happened here? You have a scar here.
There's a scar.
Mm-hmm.
Oh yeah, I think what happened,
Mm-hmm.
maybe,
Is that painful what I'm doing?
maybe I hurt myself somehow.
Oh, okay. You hurt yourself. You hit your leg. Okay. So you feel it in your foot too, or all in your calf?
All in the calf
All in the calf.
and behind the thigh.
Behind your thigh. You feel it in the middle of your calf, or this inside or outside?
In this part, I mean this side of the leg, not in the front.
All right, it's gonna feel cold, okay?
Okay. The side too I felt.
Any pain with that, or it's okay?
That's okay.
You feel that crunching?
Yeah.
That's a scar tissue.
Okay.
So it should feel like nice and smooth like this. You feel how nice and smooth?
Yeah.
That's normal. There's no scar tissue here. But here,
Here
has
too
scar
is
tissue.
too similar. Though.
Hmm?
Here too is not too hard though. Not too much pain.
Yep. Hmm. But this could pull on the other side. So
Okay.
I'm gonna release everything, and you have a scar tissue here.
Okay.
Can you see it? You
Yeah,
see
I
the
can
bump?
feel like there's something.
That's a scar
in there.
tissue here
Yeah.
and here.
Yeah.
Do you want to feel it?
Sure.
Okay. So I will show you the normal. Feel how nice. You can hold the tool.
Okay.
Feel how nice and smooth here.
Yeah, yeah.
Okay. Compare it to this.
Oh, wow, wow.
You feel those
Big
bumps?
one, yeah.
And that's all the scar tissue
Oh,
here.
wow, wow, wow.
You see, you feel that vibration
Yeah,
here?
yeah, 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 all
Yeah.
that, okay.
That's all the scar tissue.
Wow.
So that's what will pull from hip to in here. That's where the muscle attaches actually.
That's also scar tissue?
That's a scar tissue. So
The
your
hip?
muscle,
Okay.
yeah, your muscle, your hamstring attached to the ischial tuberosity here, and going all the way down here.
Ah.
So you could feel the pain anywhere,
Yeah, yeah, yeah.
because the muscle is, you know, if you compensate here or
Yeah,
compensate here, but
Yeah.
the whole muscle will be affected.
Ah.
And it doesn't matter where you feel the pain; it's matter where you feel when you have the scar tissue.
Yeah, yeah.
And when I do the whole thing here, just feel it. You will feel like a washboard.
Yeah, yeah.
Feel like a
yeah.
washboard
Yeah,
compared
yeah,
to this, like
Yeah.
nothing.
Nothing, yeah.
Yeah,
Yeah,
yeah.
yeah.
So, and here, let me get a little bit more lotion. You hear that?
I can hear it, yeah.
Mm-hmm. But you don't have issue in the front, everything in the back, is that
Still in the
correct?
back.
Mm-hmm. Okay. Yeah, some patient, like while we're doing this, you can feel it start to smoothing out. You know, Other patient take a few treatment. So I want you actually to feel this. I did this.
Mhm.
So feel it and tell me. Can you tell the difference?
Yeah, it's much. Yeah, yeah.
It
oh
start
my
to be
goodness.
smoother.
Oh
You
my
see?
goodness. Much
And I
better.
just use like it for 30 seconds. You know, so we start to see it, and you know, sometimes it's totally gone. Sometimes it's just free treatment,
Okay.
and everything clears
The
up.
feet is fine, but you want to test with the machine, you can tell, right?
Well, your feet. Do you have issue on your feet? Your
No, I'm
this area?
walking fine, but with your machine, you want to see it, it's okay?
Yeah, I will check it out. So sometimes he was walking here and limping a little bit, but we can
Oh, he was?
a little bit.
All right, okay.
Not too bad. Definitely, we're gonna do a lot of strength exercise. I will do exercise,
Okay, good,
and we're gonna do a lot of walking here until he walk the
good.
right
Good,
way.
okay.
I will show him how to walk.
Okay.
I can give him 200 exercise, but if I did not show him how to walk, probably none of those exercises will do anything.
The foot is
I
okay?
see, I see.
Yeah. Let me see.
Oh, but,
Is that painful? It's okay.
it's fine.
Don't kick me, okay?
No.
Okay. It's a little bit knot here. Scary, you want to feel it?
Oh, yeah.
You feel that's like a grain, a little bit like grainy.
Yeah.
That's usually when you have a scar tissue here because it's a small area. You feel that. It's fine.
Oh, nice.
Okay. So let me actually. I will have you sit up and we'll bring you water because I want to see how you feel. Okay, sit up for me.
Okay.
And I want you to stand up and tell me how you feel. How is your calf, your leg, how's everything feels?
It's fine.
Let's go for a
Does it
walk.
feel
We'll
better?
walk here.
Yeah, a little bit.
The pain is gone or you still feel it?
A little better. Yeah, I mean, mostly gone.
Mostly gone? Okay. And come back?
I don't feel the nerves pulling.
Okay. That's good. So you don't feel it now?
Just the nerves. I don't feel like they.
You don't feel the pain? Okay.
Yeah.
All right, so what do you think about ASTR treatment? The treatment we just had.
It's good.
Yeah.
Yeah, I like it.
All right. Awesome. Thank you. Feel free to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!